Hi, my name is Michael Quintana, recording Discussion Board 3, Week 3. So, the two things that stood out to me most in our course readings were relevant to informed consent and boundary issues. This is because both of these topics are extremely impactful to the counseling profession as a whole. More specifically, in regard to informed consent, what stood out most is how counselors construct and utilize this document to protect themselves legally. For example, in the text, I found it very eye-opening to learn that counselors utilize this document to protect themselves from multiple types of potentially litigious situations. For instance, counselors are able to use the informed consent document to pass liability of an at-risk client to a significant person in the client's life. This is interesting because, in my opinion, transferring liability of an at-risk patient to a significant person in the client's life seems unethical. This is because I believe that a layman, a person who has no significant experience in the field, cannot comprehend the liability they are agreeing to assume from the potential counselor. In other words, I feel like the counselor wiping their hands clean from liability of their client is not the right way to approach the situation. This is because, as a mental health professional whose first duty is to do no harm, in a sense is doing the greatest harm, by not using their professional expertise to fully prevent the possibility of such a situation. That being said, I do understand that when it comes to this type of situation, the choices are often limited. Thus, in my opinion, the protocol of how to handle situations of danger associated with the client should be rethought. Secondly, the boundaries section of the text also caught my attention. This is because, in my opinion, it was alarming to find out how the book defines crossing a boundary. For example, the text mentions that hugging a client has a potential to cause boundary issues in the counseling profession. However, this is alarming to me because I find that in certain situations, personal contact can enhance the therapeutic relationship. Additionally, hugging and other types of contact are considered to be norms in some cultures. Furthermore, I was also shocked to find out that attending a client's graduation is also considered crossing a boundary. This was most shocking to me because attending a ceremony seemed harmless. Essentially, what awed me the most was to find out that boundaries are not something that are set in stone, but instead are ethical issues that are extremely contingent on the situation, location, and culture. For example, in regard to counseling friends, it was interesting to learn that usually it would be considered an ethical violation. However, depending on the context of the situation, it can be considered perfectly normal. For instance, the book mentioned that in the military it is common that counselors may be the only available provider and expected to counsel all service members, including personal friends, direct supervisors, and co-workers. So ultimately, what stood out to me most was the fact that the counseling profession is extremely contingent by its very nature, more specifically, how the counseling profession does not abide by clear guidelines that are considered relevant across the board, regardless of the context. This is interesting to me because I feel that a blatant lack of clarity can cause significant issues down the road. Even more, a lack of clarity has the potential to harm the counseling profession as a whole, because it gives the impression of a profession void of standards.